This is some feedback on a case that I think could have been done better. This is a case of a patient with ulcers or skin defects, probably a diabetic patient who has these wounds that lead to infections of the bone ultimately. And so these are ordered usually on inpatients to see if there's any evidence of bone infection or if there are fluid collections. In this case, the technologist and the fellow protocoling, I guess, decided to do the whole foot because there were several sites of ulceration, or maybe they didn't know prior to the study where those sites of ulceration were. So they decided to cover the whole thing, which is fine. The problem with this case is, let's see if I can get the right, is the coverage of the sites of ulceration. So here you can see a big skin defect here. That is an ulcer. And what you're looking for are bone changes nearby and also fluid collection changes. Now, it happens to be that also on the other side of the ankle, this is the medial ankle, this is the lateral ankle, and at these bony protuberances, the malleoli is where we often get these ulcers. So there's another ulcer out here, and you can actually see what is a fluid collection in this area. The problem is, this is the only plane that we see this in cross-section, and you can see it kind of comes back posteriorly, and it's not clear what its relation is to this tendon sheath or where it is. An axial image through this area would reveal this, and if you know where the ulcers are, you should always try to cover it in cross-section. So in this case, these ulcers would have been best covered by both this plane, which we'll say the coronal plane, and also the axial plane. But instead, a lot of time in this exam was spent on sagittal planes. Now, sagittal plane, you can usually see problems, like maybe this is part of that medial ulcer, but because of partial volume averaging and being in the plane of the lesion, it's hard to make any important calls about their relationship to the other structures. And the fact that we don't have axial images is a problem. The sagittal images are kind of nice, broad pictures of the whole foot, but they don't help in this case to identify the localization of these abnormalities at the ankle. In addition, the person had an ulcer, let's see if I can find it, out here by the fifth metatarsal head. So this is well covered. This is a good, we always do like axials through things, or short axis in this case. But then again, looking at it in the other plane, it would have been best to capture this, since the ulcer is right here, it would have been best to capture it in this plane so we could see its relation to the bone. Instead, what was done was a sagittal image where it's hard to say if this signal abnormality is genuinely in the bone or is it partial volume averaging with the adjacent soft tissues. So imaging plane is an important choice to make. In this case, I think that it's important for a technologist to recognize where ulcers are by either by looking through the medical record, by talking to the patient and having them point it out, or unwrapping and looking at their foot directly. Any of those things can help reveal where those ulcers are and make good choices about imaging plane.